Hi folks, I'm Jonathan Zor coming to you with another VCIC Humanitarian Spotlight. Through the Virginia Center for Inclusive Communities Humanitarian Spotlight Series, I'm interviewing past Humanitarian Award recipients who are demonstrating important leadership in advancing an equitable and inclusive response to the COVID-19 pandemic. Today, I'm so excited to be joined by Ms. Tanya Gonzalez, a 2018 VCIC Humanitarian Award recipient from our Richmond chapter. Ms. Gonzalez is Executive Director of the Sacred Heart Center, one of the most important organizations in Richmond, with a mission to connect Latino families with tools to thrive and flourish. She previously served as the manager of Richmond's Office of Multicultural Affairs. Tanya is very active in the community, and she's a graduate of Leadership Metro Richmond, the Connecting Communities Fellowship Program, the Richmond Memorial Health Foundation's Equity and Health Fellowship, the Minority Political Leadership Institute, among many other affiliations. Tanya, you're incredibly busy and important. I'm really grateful to you for carving out a few minutes to chat with me today.
Oh, thank you, Jonathan, for the opportunity. I'm glad to be here.
Yeah, so you have a really important vantage point on the experiences of the Latino, Latinx community in the Richmond area. What are some of the unique needs that you're seeing emerge as a result of this pandemic?
Yes, so Sacred Heart Center has basically been working on pivoting our services and programs really since March 16th, when we temporarily suspended programming and closed our building to the public because of the pandemic. We've shifted all of our educational programming to virtual and remote options. The staff has done amazing work in just thinking creatively around that, and all of our educational programs for adults, youth, and children have continued to operate through those new methodologies. And then we also created several crisis response programs because of the unique needs that we were seeing in the community. So a key program and service has been the reopening of our food pantry in partnership with Bainbridge Community Ministries. We've done that as a curbside model since March 30th, and have served about 150 people daily through that. Close to 4,000 people over the last few weeks have received food assistance. And we're seeing some interesting trends through that. We are seeing more individuals in our Latinx community contract the virus. The latest numbers I saw recently were that 50% of the cases that we know ethnicity for in the city of Richmond are Latinx individuals. And we are receiving more calls from families that it's not even, the economy has to do with it, financial situation has to do with it, but it's more about not being able to physically go out to purchase food because of illness, because of quarantine, because of some of those challenges. So we've begun delivering food as well. We've been doing that for several weeks to families through our bus, and are expanding some of that support for families. So that's been a key response, and part of what we're seeing and what's very concerning to us is the disproportionate impact of the coronavirus on the immigrant, specifically Latinx population here in the Richmond area. We've also been receiving many calls from individuals that have had a reduction in work hours or have lost their jobs altogether. So we're kind of seeing two extremes with that. Either people are still working and they're actually physically going out to work, so it's not a work from home situation for our Latinx immigrant families, or they've lost their jobs, been laid off, sometimes may not be able to access different benefits for a variety of different reasons. So that's what we've been seeing.
The needs are really vast, and I think one of the challenges is that a lot of the concerns that the Latinx community were experiencing in Richmond, they were experiencing before the pandemic, and now a lot of these things are amplified, whether it's food insecurity or concerns around jobs or safety, things like that. One of the areas where our organizations have periodically intersected is around supporting young people in our local schools, and that's been an area where schools have really struggled to provide the appropriate services and resources for newcomers to the United States, and specifically our Latino, Latinx neighbors. Can you talk a little bit about some of the needs that you're seeing from folks who are in school and are now at home and trying to make that transition?
Sure. Families are struggling with the technology piece. We were fortunate and just really grateful to receive some response funding from area foundations. And so part of that funding we've actually been using to purchase laptops to distribute to families that may not have more than one laptop or any laptops in the home. I think we've seen efforts by the schools to get more equipment out, which has been great and important, but it may still not be enough. So if it's one household that has several children, or maybe mom or dad are in one of our classes, say the ESL program or GED program, if every person in the household is needing to be on a device, there aren't enough devices, or internet connectivity might be an issue, or just the digital literacy gap. People may be having to, especially for adults, maybe having to get on a computer and navigate technology that they're not familiar with. So that's something we're definitely seeing. Parents that are still having to go out to work, as I mentioned before, and now have children at home, have lost opportunities for childcare. So that's a difficulty. The Sacred Heart Center has worked really hard over the last few years to mitigate barriers for adults coming into our classes, like the childcare piece and transportation piece. So if mom or dad is able to enroll in our classes that are going on now virtually, they now may have everyone at home at the same time, so they may not be able to progress as much as they would like on some of those goals, educational goals, because of that. So lots going on, which then of course impacts family dynamics and mental health, wellness, and all of that.
The needs are really great, and I know that there's been a spirit of volunteerism and community that has been a real support to Sacred Heart Center. For those who are watching this who may want to get involved or make a difference, what are some opportunities, what advice would you give them right now?
Yes, and we're so grateful for those that have stepped up already to be in solidarity with our community, whether that's been through direct financial contributions, through volunteering, through food donations, hygiene items. We've received donations of masks. It's just been incredible. What I'll say is this is going to be a marathon, not a sprint. I've been saying that and I'll keep repeating that. So we do need your help still. We're hopeful that people will continue to support us. This is just the beginning of the work that we'll be doing in terms of recovery. We're thinking through what that's going to look like for our community. So there's lots of ways to get involved. We're still receiving donated items for our food pantry for in terms of hygiene or sanitation to hand out to community members, masks as well. Financial contributions or gifts are always very welcome. And we do have, it's kind of limited at the moment, but we always have specific volunteer opportunities. So all of that information is available on our website, which is shcrichmond.org. Again, that's SHC for Sacred Heart Center, richmond.org.
Wonderful. I hope folks will take advantage, and certainly the need is great, and be able to see that support get put to good use right away. Tanya, I'm so grateful for your partnership and for your leadership in the community. Thank you for taking a few minutes to chat with me.
Thank you. It's great to see you virtually and wish you all the best as well.